In patients with ischemic stroke, where there is blockage of the blood vessel by means of a clot and thereby causing symptoms like sudden onset of weakness of one half of the body, difficulty in walking, ataxia or vision abnormality, difficulty in understanding spoken language, or not able to pronounce words properly. So in this situation, it is important to rush to the hospital as early as possible in a tertiary stroke care center, because in the first few hours after the onset of symptoms, if the clot can be dissolved by various methods, then the blood supply, if can be restored within the first few hours after the onset of symptoms, then some symptoms can be totally reversed immediately. And after 1 month after doing continuous physiotherapy, then these patients who receive these treatments fare better compared to those who did not receive the treatment. Now, what are those advanced treatments? In the first few hours after the onset of symptoms, we can give an injection called tenecteplase or recombinant tissue neoplasmogen activator, which is given intravenously to dissolve the clot. But even after the first few hours have passed, even up to 12 hours sometimes now, with the latest treatment and available in the form of advanced cath lab and the presence of interventional radiologists and interventional neurologists and neurosurgeons, where you can directly place a catheter into the affected blood vessels of the brain and thereby suck the clot out, or keep a stent and retrieve the clot out, and thereby immediately causing blue, restoring the blood supply. And this is supposed to be much more successful if done properly and in the right time and at the right hospital. So this is very, very important. Please remember to come to the hospital as early as possible and do not waste time at smaller centers or at CL, private clinics even if it belongs to neurologists. The best time is the golden hour within the onset of the symptoms. Rush to the hospital and emergency.